Tell us about the critical shortage of the equipment for healthcare workers in the province. It appears to be an issue, sadly, that exists elsewhere too.
Indeed, well, as today we are meant to be observing World Health Day, which, like you said, the theme is to support nurses and midwives. Here in KZN, there are a number of healthcare workers, including nurses, who are in a critical position because of the critical shortage of PPE or personal protective equipment. This as they are on the front line of fighting the COVID-19 disease. Now, just to talk more about this, I'm joined by the spokesperson for the Democratic Nursing Organization of South Africa, or DENOSA, Mr. Mandla Shabangu. Mr. Shabangu, thank you for speaking to Newzroom Africa. Now, we were just chatting earlier, and you tell me that there are at least 17 healthcare workers in KZN that are infected with COVID-19. Can you just give us a wrap of this, and do you know if these numbers are increasing?
Thank you very much for giving us this opportunity. Indeed, in KZN, we are having that number being confirmed, and we are worried that that number might go up because the frustration that our health workers are facing now is that it looks like the positive cases that have been confirmed, there has not been any swift reaction from managers in removing those workers to go for quarantine. They continue working some 2 or 3 days while confirmed positive, exposing others. And we have since learned that in one public hospital in Durban, there is a serious concern of nurses being intimidated not to declare to their colleagues that they are positive, but nurses are sick. And we have one person who passed away who was admitted in that hospital, but currently that person, the department where the person was admitted on, nurses are very sick there, but they cannot talk to anyone because they've been gagged that if they talk about corona, if they talk to anyone about their frustration, they're going to be dealt with. We are very concerned as DENOSA, and we are urging the MEC that can they fast track the issue of tracing of people and ensuring that all those who have come into contact with these people are tested, because we are worried about hospitals who are trying to portray a positive picture that they have no one infected, while nurses are very affected and they are very anxious and scared because of the scourge of the virus. And we want to urge the MEC to try to respond to our calls, because we are talking to the MEC, but the deployment that the MEC is giving, we feel it is not justifying our plea, because we know MEC cannot run around the province, but he's got people who are reporting to him who must be deployed and deal with these things. But we see a very slow pace when it comes to that, and our nurses are very worried because it looks like there's no very little help that is coming our way.
On that note, I mean, overnight we saw the number of cases across the country rise. In KZN, there are now 257 cases of COVID-19. But we hear because of the shortage of PPE, rationing is being done of that equipment. What are the nurses saying about this? I mean, are there instances where they do not have any protective gear?
We can still confirm that nurses are still saying they don't have PPEs. And this is a worldwide problem, but nurses are asking the employer to do what they can do to assist them, not to come and tell them we don't have PPE, because that does not solve their problem. Their problem is that they need to be protected so that they can protect our communities. But now, if they are told to reuse these PPEs, we're receiving calls every second minute, people saying, my manager is intimidating me, saying going to charge me if I don't go and nurse these patients, while there's no PPE, and they say, you know we don't have PPE. Now, the question then borders that why nurses are the victims of this? Because nurses, their role is to work, is not to secure PPEs. If there are no PPEs, why are you putting on the shoulders of nurses? Because nurses are there to render the service, but they need to be first protected against this virus. But we do not see much being done by those who are leading the department. Instead, they are hiding behind powers of intimidation, which we take it very serious, because lately we've decided as KZN PEC that maybe we need to explore now that a manager who forces an employee to go and nurse a patient without protective equipment, that manager be sued on her personal capacity, because you are exposing a person to that intentionally, knowingly that you have not protected that person, but you are abusing your power in saying, because I'm a manager, I'm allocating you. We are exploring those avenues because we spoke to the MEC. We received some of the information that some PPEs have arrived according to the MEC, but the attitude of the managers, the CEOs in hospitals are unbecoming because they are intimidating workers that I will give you a mask that you must keep for 5 days and reuse it. If you come back with a request for the next mask, you're not going to get it. You're going to work without a mask because I will only issue one mask per week, which we think is very absurd because before COVID-19, nurses were nursing TB patients with N95, which is the most suitable one. But now that there's COVID-19, there's TB, they are told there's no N95 to nurse those patients. We feel that the department is letting the workers down with this whole behavior, but we are exploring those options that maybe we need to set an example with one manager, and we pray that no nurse gets affected because we want to encourage that nurse to sue that manager on her personal capacity to take responsibility of her negligence.
Mr. Shabangu, I must also ask about the issue of transport. Nurses are our essential workers at this point, extremely important healthcare workers, but you have told us that many of them do not even have the option of coming to work because of the taxi regulations that are in place in the midst of the lockdown. What are the challenges they're experiencing there?
Maybe let's start by saying we thought this lockdown was to correct the spread of the virus. But we are starting to see now that this lockdown, maybe it was designed to deal with public servants, especially nurses. Because when the lockdown was designed, the rules that are being amended now and then is to cater for any other people except the essential workers. Now, we hear people saying nurses and all other health workers are essential services, but we do not see that in their behavior. In their behavior, they like nothing. Because if you're saying a nurse who's staying in a rural area where she will rely on a public transport, and then you say, no, you're not going to pay taxi drivers for going there. Obviously, taxi drivers are in business. They're not going to go there for free. Now, nurses are stranded there. They don't have transport. And we've requested the MEC to instruct the HOD that can the transport of the hospitals fetch nurses? They are refusing to do that. And to a point that some have decided to resort to instructing our members to prepare that they're going to come and sleep in the hospital because they're not going to fetch them from home. If you're saying you cannot sleep in a hospital, then they're saying we're going to give you, we live without pay. As I'm standing in front of Eddington, I received a call last night from one night super, intimidating my member to say because you could not come to work last week 2 days, you must sign leave without pay. While the instruction is very clear to say institutions must make means of transporting these workers because it is not their fault that there is no transport. They stand by the street and expose themselves to dangers. But you find managers who come with that attitude that we're going to give you leave without pay. Is it the fault of the health workers that there is no taxes? We think that the Department of Labor in this committee must really intervene on this thing.
Thank you very much, Mr. Mandla Shabangu. Of course, we'll be speaking to him a bit more later on. He's saying, of course, there needs to be an urgent support now for nurses, especially as we observe World Health Day. And the tagline for that is to support your nurses and midwives in KZN. Nurses need that critical support.